Good morning. I'm calling together the Board of Health meeting for Town of Shrewsbury. Today's December 11th. The first order of business, I want to welcome Commissioner Matty Castile, Commissioner for Public Health in Worcester. Commissioner Castile has been a long-time internal medicine physician in the city and has a stellar record of serving the underserved as well as leadership roles, and we're indeed delighted that she's here to join us, and she's filling in on the interim for Mr. Solo Dennis, who has moved on from his position. So Commissioner Castile, welcome.
Thank you so much.
Yeah.
Thank you.
Minutes of the last meeting from November 20th were distributed electronically. If there are any amendments, if not, we'll entertain a motion to accept them as written.
Yeah. Second.
Great. Ms. Rosacci is calling in, and so we'll, Carrie, do we wait till she calls in? She's in.
on.
All right. So, motion to.
Good morning.
Good morning. Ms. Rosacci, do you approve the minutes?
Yes, second.
Okay, all right. So Abraham votes aye. Ms. Bott.
Emily votes aye.
And Karen, you vote aye as well?
Aye.
Okay, thank you. The minutes are approved. All right, we have the communicable disease update. I'll turn it over to Commissioner Castile and Ms. Houghton. Yeah.
Hello, good morning, everyone. We'll start with the respiratory illness update. According to the wastewater data that we receive every week, the numbers are starting to increase a little bit. As we expect, people are spending more time indoors. So COVID numbers actually just went up a little bit from October, like literally very few. And they're still pretty low, but then again, as we always say, we know these numbers because this is reported illness, and we don't know the cases that are not reported. So obviously the number would be different than anything we have. Flu, even though there's an expected increase, we just had a handful of cases over the last month, again, underreported. We haven't had any measles or pertussis. We haven't had any large outbreaks. We're still recommending for respiratory illness prevention, masking, hand hygiene, and talk to your physician about what vaccines they recommend for you. And I'm going to mention something that I did start mentioning it last month and the month before that, is a little bit about global outbreaks, and because they may or may not affect the US. So it's good to at least know what's out there. And currently, last month I reported the Marburg virus, and that was affecting Rwanda then. Now it's also affecting Ethiopia. So that's something to watch. And at this point in time, there's no risk to the US at this point in time. There's another one. It's actually an arborvirus. It's called Oropouche, and the outbreak is in Central and South America currently. That's been coming and going all year, but they've had over, in those areas, they've had over 11,000 cases. So it's interesting. It's from the midge of a mosquito. So there's a particular type of mosquito found in those areas. So obviously travel would bring it to and from other places. There's no vaccine, but we do get concerned with vulnerable populations, which include pregnant women, because this infection can be passed down to the fetus. That's why that's important. Prevention, well, with all arborvirus infections and exposures, you have to prevent bug bites. And if you can do that, you're in pretty good shape. And let's see, up and coming, we had a Shrewsbury High School Health Fair yesterday, well attended, lots of vendors. Students asked lots of questions, showed a lot of interest. They made beautiful posters on health-related topics. It was just a great event, well over 250, 260 students. So that was nice, and they'll continue that next year. And that's about it for the nursing piece for communicable diseases, unless anybody has any questions.
And talking of international outbreaks, our first case of Mpox in the US has occurred, so formerly called monkeypox, now called Mpox.
Mpox, yeah.
First diagnosed case in the US, so there's only one so far, but hopefully no more. We
Right,
had a
I'll
previous-
have a good update on that next time.
Yeah. Yeah, definitely. Great. Questions for Ms. Houghton?
No further questions, thank you.
Great.
Thank you.
Excellent, thank you. Thank you for that. All right, we'll discuss the updates from the Central Mass Regional Public Health Alliance. Ms. Stefanski?
Good morning. So I'll cover the environmental health inspections that were conducted since the last time we met. There were a few temporary food events that I did go out and inspect a few vendors at those. And I did yesterday just do a pre-operational inspection for a new establishment, Omi Korean Barbecue. So they will be, they've passed, they'll hopefully be up and running within the next 2 weeks. That's their goal. We did have one complaint of a foodborne illness. I don't know that it reached our public health nursing team, but I did conduct an inspection. Regardless, there were minimal violations, some habit changes that need to happen amongst employees, and we'll revisit those when they're due for their next routine inspection next month.
Okay, great. So no patterns that impress you with any of the food-borne outbreaks or illnesses?
No.
Great. And I know you've been busy, so thank you for
Yes.
shoe leather epidemiology, as we call it, pounding the pavement frequently now. Yeah.
Thank
Other questions for Ms. Stefanski?
No further questions, thank you for all the work you do.
All right, great. Our next meeting is, Carrie, remind me, January 28th?
January 29th,
29th,
8
at 8 a.m.
o'clock in this room.
Great, all right. So we got Dr.
Um,
Castile.
I wanted to provide a small update.
Oh, please do. Yes, my apologies.
So-
Yeah.
Yeah. Cherry Tangri, Shared Services Coordinator. So last week we had our Governance Council meeting. So I basically oversee the Public Health Excellence Grant, PHE grant. So we had our Governance Board Council, which we are required to have every quarter. That the structure of that group is. Originally, it was the town managers, but because our new IMA, which is the intermunicipal agreement that's in progress, it's being worked on by our legal department, and we are working with the Office of Local and Regional Health to work with them on whatever the state requirements are. So basically, that group, in that group, we met and we discussed the programmatic updates and the grant deliverables. So at some point, hopefully in January, the town manager will receive the draft to review the guidelines on the IMA, and then based on the structure requirements of that governance council group, there has to be a board representative on that group. So I just wanted to give a heads up that that is something that will be coming up in the next year.
Sure, great, thank
Thank you.
you. We look forward to that. Yeah. Any other agenda items? Hearing none, we'll take a motion to adjourn. Walker?
Second the motion?
Ms. Rosacci?
Aye.
Thank you. Abraham votes aye, the meeting is adjourned. Wish everyone a happy holiday season.
Oh, thank you. You as well.
Thank you.